myself, Council Members Benton, Bradford, Gregg, Vice Chair Huffman, Council Member Nash, and Council Member Weiner. We also have a public comment, and so we will start with public comment, and it is from Mr. Steve Ryder, and he is referencing RS 2025-1185, and so I will turn on the microphone.
Thank you, Madam Chair and members of the committee. I fully support the allocation of $400,000 to Safe Haven. One of the biggest success stories in this town regarding homeless service providers was Safe Haven. They were able to get some TANF money, temporary assistance for needy families from the state. And their goal was to house 100 families in 100 days. They did that in less than 100 days. That was a real success story, and it shows what can happen when you have resources that are available. And I'm really grateful because I know a family was out on the street that personally benefited from that. And so I really appreciate Safe Haven, the state, Office of Homeless Services, and everybody working together so that could be. I did want to say that everybody in your district, you have homeless people that are there. And the issue is they're just not resources. The federal government has not really come forward and put the money there where they did years ago. And so every single city is struggling with how they're going to address this issue. And I know every single council member out there on a weekly basis, I'm sure you're hearing, hey, can you do something? And I think the federal government has to come forward and do more because we are not going to solve this. Frankly, the numbers are increasing, which I'm very worried about because if we keep going down this road here, there's going to be more people that are going to be out on the street and looking for alternatives. And frankly, I think we can do better and we really should do better. Thank you very much. I'm sorry I'm a little under the weather, so I'm going to take off a little early today. So it's good to see everybody. Thank you.
Thank you, Mr. Ryder, for coming and sharing your feedback with us. We will go ahead and get started. I do have a proposed consent agenda, and the consent agenda includes everything with the exception of, sorry, I've got single-sided pages, and I'm not used to such a luxurious reading experience. Everything except item number 9, RS 2025-1198. Is there anybody that would like anything removed from my proposed consent agenda? Councilmember Benton.
Thank you, Chair. I would like to pull 6 and 10.
6 and 10. Okay. All right, got those. Anybody else have anything they'd like to remove from the consent agenda? All right, I'll go ahead and read these and then see if anyone has anything they'd like to remove prior to us moving forward. First item on the proposed consent agenda is RS 2025-1178, a resolution approving amendments 1 and 2 to a Child and Family Intervention Services grant from the Tennessee Department of Children's Services to the Metropolitan Government, acting by and through the Davidson County Juvenile Court to provide community-based case management and probation services to children at high risk of state custody. Item number 2, RS 2025-1181, a resolution approving amendment number 1 to a grant contract between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Action Commission and the United Way of Middle Tennessee to modify the scope of program, extend the grant term, and modify the number of allowable invoices for a county-wide child care study. Item number 3, RS 2025-1182, a resolution approving a contract by and between the State of Tennessee, Tennessee Department of Health, and the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Board of Health to access the Vital Records Information Systems Management, or VRISM, system for the purpose of issuing copies of birth and death certificates. Item number 4, RS 2025-1183, a resolution approving Amendment 1 to a grant from the State of Tennessee Department of Human Services to the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Board of Health to conduct immunization record audits for child care centers, drop-in centers, and group child care homes to ensure the safety and well-being of children and families in Tennessee. Item number 5, RS 2025-1184, a resolution accepting a grant from the Friends of Metro Animal Care and Control to the Metropolitan Government, acting by and through the Metropolitan Board of Health to provide funding for various programs for shelter animals. Item number 7, RS 2025-1196, a resolution approving Amendment 1 to a Stop Fatality Review Grant from the Tennessee Department of Finance and Administration to the Metropolitan Government, acting by and through the Office of Family Safety to promote a coordinated multidisciplinary approach to improving the criminal justice system's response to sexual assault, domestic violence, dating violence, and stalking crimes. Item number 8, RS 2025-1197, a resolution approving an intergovernmental agreement by and between the Organized Crime Drug Enforcement Task Force, or OCD-ETF, and the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Nashville Police Department for reimbursement of overtime salary costs for certain officers through the use of the state and local overtime and authorized expenses and strategic initiatives program. And then item number 11, the late filed resolution, a resolution accepting a tobacco use prevention and control services grant from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health to improve the health of citizens of Davidson County by preventing and controlling the use of tobacco. Do we have anything that needs to come off the consent agenda? Do we have a motion? Okay, it's been moved and properly seconded. All those in favor of the consent agenda, please say aye. All those opposed? Anyone not voting? All right, thank you. That is 7 in favor, 0 against, 0 not voting. So let's go to item number 6. This is RS 2025-1185, a resolution appropriating a total of $400,000 to Safe Haven Family Shelter and amending a grant contract between the Metropolitan Government of Nashville and Davidson County, acting by and through the Office of Homeless Services and Safe Haven Family Shelter to increase the grant amount and extend the grant term for the provision of hotel rooms across the Nashville area for emergency alternative shelter for families with minor children. Do I have a motion? Okay, it's been moved and properly seconded. Councilmember Benton, you had some questions. I'll recognize you.
Thank you, Chair. First of all, I'd like to say that I think this is right on target for a continuum of care. We're targeting those families with minor children. That's a big deal. And we want to get them off the street as quickly as possible. So I love the idea here. I was just curious, and really I guess my question is, and if Miss April is available for that, I'm curious about what we're getting. Like, is there, for the $400,000, is there a number of nights that covers? And I guess I'm really getting at our cost per night, or an estimated cost per night.
Thank you. Hi, Director Calvin from the Office of Homeless Services. I have my team here with me, and also I have someone from Safe Haven here with me. So I don't have the cost per night in front of me, but I do have the, in the year's time that we provided that grant last year, it served 166, you have the nights per service, look at there. 166 individuals, which was 56 households, and 82% moved into permanent housing. Let's see, a total of, let's see, I don't see the cost per night, but I think the, it's not there. Yeah, so I think they've worked out a really great deal with the hotel owner for the nights, the cost per night, but also what's factored into that is like case management services, safe haven services. So we're actually billed on a per diem, which ensures that we're not paying for beds that are not utilized. It's actually paying for beds that it's on a per diem per person.
Councilmember Benton? No more questions? Okay, it looks like Councilmember Huffman, you're recognized.
Thank you, Chair, and thank you, Director Calvin, and to Drew for being here. First, I just want to go on the record for those that aren't familiar with Safe Haven's work. It's incredible. We had a public comment, of course, from a familiar face that highlighted the expedited way that we've got a lot of families housed. So the amount, I don't even bat an eye at because I know that it's going to be put to good use. My question is just over the overall process for those that don't know. So you identify a family in need. What next for everybody?
Great question. I do want to say that we did the dollar amount times number of people served, and that is $2,921 per person. So that's really like a drop in the bucket. So referrals are made through coordinated entry. Our department is the lead on coordinated entry, and referrals are made. We make sure to target two things. People living in places not meant for habitation or people living in shelters. And so like our large Nashville rescue mission, sometimes their numbers get pretty high and they're not able to provide that intensive case management services. And so Safe Haven, by way of Drew and his team, they're instrumental in being able to take those referrals real time and not only moving them into a hotel or they used to actually use their shelter and now they actually use the hotel because they're able to serve more people rather than their shelter, which had the capacity of 10. Yeah. So now they're able to serve more people real time, but they utilize a braiding of funding from their COC grants to help with rapid rehousing. So these Metro dollars really help to like stop the bleeding and get people in quickly. And then they use the braiding of funding to get them into permanent housing or ongoing resources by way of the COC dollars.
Thank you for that. And just a quick follow-up, and I think this one would be for you, Drew. It may be. We'll see. We'll see who jumps at it. So it's a simple question. Just from the time that a family is identified, what's the average time until they're placed in housing?
And can you introduce yourself for everybody too?
Yeah, Drew Freeman, CEO of Safe Haven Family Shelter. Yeah, Jordan, that's really gone up. Our preference is anywhere from 30 days to 60. We're sitting around 90 to 100 before we can find permanent housing solution for them.
And will this grant help with that number?
Absolutely.
Thank you.
Absolutely.
All right, thank you, Councilmember Huffman. Councilmember Bradford.
Thank you, Chair. Question that came to me listening to this with the families. Do we collect data on how long they were homeless before they came into the system? Do we kind of have an idea, like on average, they may be homeless for a few days, a few months, a few years before they come in? And then secondly, when we talk about families, some families may, while they were on the streets, may have had pets. So are some of the hotels being used pet friendly?
Yeah, we do. Sorry. Yeah, we do work with our families that do have pets, especially service animals, and make sure they have a place that they can bring those animals.
And also, I think connecting with local hotels, they're able to even be pets that may not be service animals, which is a little bit different than when you're in a congregate shelter.
Absolutely.
All right. And did you answer the question about do we have data? Do we kind of know on average how long they're homeless before they come into the system?
We do have that data. I did not bring it here today, but I can make sure to pull a report and then I'll email it to Council Lady Evans and yourself.
I think I'd be curious to see that.
All right, thank you, Councilmember Bradford. Any other questions? All right, do we have a motion? All right, it's been moved and seconded. All those in favor? Anyone opposed? Anyone not voting? All right, we recommend approval. 9 in favor, 0 against, 0 not voting. Okay, let's go to item number 9, RS 2025-1198. A resolution approving an application for a community traffic safety enforcement and education grant from the Tennessee Highway Safety Office to the Metropolitan Government, acting by and through the Metropolitan Nashville Police Department for community-based efforts that employ highly visible and sustained enforcement, coupled with the community outreach events to address impaired driving and other unsafe behaviors. Do we have a motion?
So moved.
Okay, it's been moved and properly seconded. I wanted to have this one pulled off just because I had a question. So Deputy Chief Gilder, if you're able to answer it. I just wanted you to say on the record that, related to kind of the enforcement activities that happened over the weekend, that accepting this grant is not going to tie us or require us to have any kind of cooperative activities with the Tennessee Department of Safety and the Highway Patrol.
Yeah. Good afternoon, Chris Gilder, Metro Police Department. Now, this is the grant that we receive every year related to DUI and dangerous driving enforcement and education. I don't have the exact number of years, but I mean, probably close to 10, I would say we've been receiving this. It funds overtime initiatives for additional officers during hours when you have a high prevalence of drunk driving. To conduct enforcement around those events. Also, we do other education events, like we put on a teen driver awareness class. We do child safety seat checks and other safety events like that.
All right. Anybody else have any questions on this one? All right. Do we have a motion? Okay, it's been moved and properly seconded. All those in favor? Anyone opposed? Anyone not? You're going to abstain? Okay. One not voting. So we recommend approval, 8 in favor, 0 against, 1 not voting. All right, let's go to item number 10, RS 2025-1209, a resolution requesting the mayor's office to initiate an investigation into the operations practices and leadership culture of the Davidson County Department of Emergency Communications and report findings to the Metropolitan County Council. Do we have a motion? Okay, it's been moved and properly seconded. I will recognize the sponsor if she would like to speak on this item before I open it up for discussion. Councilmember Ellis.
Thank you, Chair. I was worried I wouldn't be recognized after driving down here this early in the day. I don't have any context to add to the bill. I think it's pretty thorough as to what the issue is. I will say that I am planning on deferring it, though, to the June the 3rd meeting. After talking with various stakeholders and especially with Kirsten Wilson from the mayor's office and also Shannon Hall, I'm on the side that, we're all going to be working in good faith to resolve the issue, but I still want there to be the spotlight on what's going on. And keeping that pressure on. But I would love for everyone here in committee to support it so that we could, continue moving forward.
All right. Thank you, Councilmember Ellis. Do we have any questions or discussion on this item? Councilmember Prepty.
Thank you, Madam Chair. Just quick clarification question for the sponsor. To what day is she wanting it to be deferred?
To June the 3rd, which gets us through the next meeting or 2 meetings, I think.
That's 2 meetings.
Yes, it's just through 2 meetings.
So with that, Madam Chair, I would move for a 2-meeting deferral with a re-referral back to committee.
All right. Do we have a second? All right. It's been moved and properly seconded. All those in favor of a 2-meeting deferral with a re-referral back to committee, please say aye. Aye. Anyone opposed? Anyone not voting? All right. So we recommended a 2-meeting deferral. That's 9 in favor, 0 against, 0 not voting. All right. Let me take department updates really quick, just because I know there's some questions around Old Tent City. And then we will hear from our speaker today, Amanda Clellan, who is from Thistle Farms. And so with that, Director Calvin, or I don't know if y'all, Ms. Cantway, if you guys want to come back to the podium, because I got a couple of questions from the public, and then I think there's committee members that want to ask questions. And so, Councilmember Huffman, do you have anything you want to start with? Okay, let me go ahead and invite you to speak, please.
Thank you, Chair. Thank you, Director Calvin. My question around the closure is really around spillage to other areas of the county. Chair Evans and I out in Hermitage have already seen a little bit of this from Old Tent City, from former residents that are now taking up residence in Hermitage. What is the OHS strategy to track these individuals, to make sure that they're not going to just another section of town necessarily, but that they're actually starting the housing process? And what does that look like?
Thank you for that information, or for that question. I do want to say that this process started about 7 to 8 months ago. We have a very detailed by name list of all the individuals there. Even prior to posting the camp, we made sure to have 3 dedicated dates and times to double check that list. So we went in the morning, we went at noon, and we went in the afternoon. Have a very robust list that we've worked with other nonprofits as well. And part of our strategy of ensuring that people stay there, that's why we give them the notice first instead of sharing that information with the public prior to giving them that information, because we would want them to stay there. We have already housed 52 to 54, my number changed a little bit today, individuals, and the strategy is, one, they should stay there. Our notice basically says, please do not leave, services will be provided. If there's people that you know that's moved out to a different zip code, just make sure that our team is aware. You work closely with Lakeisha, she'll be sure to, she's at that camp every day as well. So we'll be sure to go to other areas that they may have been. Sometimes it's confusing when you have a local government saying, don't leave, we have housing and enough services, whether it be temporary, whether it be, long-term. We have services that are readily available, and then they hear from others, whether it's an advocacy agency or, others that may not be familiar with our camp housing process. Sometimes it's confusing to the individuals.
Thank you. And just one more question. So you sparked this one. So you said 54 people have been housed out of how many total?
There was a total of 120 that resided in that camp. So several of them were housed prior to. There was a lot of work that went into. There was a lot of work. There was a lot of work that went into housing people throughout the last year from that camp, knowing that the prioritization team had already identified that as the next location.
Thank you.
Thank you, Councilmember Huffman. Any other, let me grab Councilmember Weiner, and then I'm going to come back to Councilmember Welsh. Councilmember Weiner, you're recognized.
Thank you. 2 questions. First of all, thank you for all the work that you did out there. I know that it's been grueling. How many folks have not made a commitment one way or the other? And how many of the folks over there have you not been able to have that conversation with? Do you have any sense of what that looks like?
Oh, we've had the conversation with everyone. We're in that camp from 10 to 3 every day, 10 to 2. 10 to 2, Monday through Friday, not on Saturdays and Sundays. And so they've had that conversation before the notices went out. We had the conversation, the 3 days that we were there getting, double checking the by name list. And then we had the conversation when we passed out the notice. And every day our outreach team is in that camp. And then actually every Thursday, we partner with community partners to have a resource fair there on site, which is exciting. So there's maybe between 5 to 10 community partners that's there with us every Thursday as well. And, I do want to read, like, one of the goals, there's a community strategy that we're using. And one of the main goal in this community strategy is by pairing targeted and intensive outreach, which is what we're doing right now, right? With housing solutions to the most vulnerable encampments in Nashville, we will provide them with interim housing options that lead to permanent housing solutions. And so all of the services that we're providing is right on target with our strategy, our community strategy.
Thank you. I have one more question, Chair, if that's okay.
Sure.
In terms of the temporary housing, how long is that time frame typically? And when they come to the end of whatever this time frame is, what are the reasons that they do not get extended if they have no solution and end up right back, for example, in Bellevue, which is what's happening?
Well, I'll say from previous camp closures, we have a 12% recidivism rate, meaning only 12% of the people are ending up homeless again. So that means 88% this system and this strategy is working for. And then we have outreach that will continue to provide services to those that the 12% that it may not have worked for. The bulk of your question, I think I want to go back a little bit. I went too far and then I want to pull back. I'll say that the majority of the people that we provided services for have all said, hey, I want housing. Even the people in the RVs have said, hey, this is something that I want. I know there's a petition that's asking for a little more time or asking for land or, we're following national best practices and having a land for people to govern themselves. Unfortunately, it's just not best practices and probably not safe. I do want to elevate to you all here that as my outreach team is out there every day, there's gunshots that they're out there experiencing as well. And just yesterday, there was yesterday and the day before, there was one person shot near in the camp in the middle of the night and then two down the way. So camps are not safe for individuals and definitely not safe for individuals to govern themselves.
That's helpful. Thank you.
Thank you. I do also want to leverage that parks. I would be remiss if I didn't say this, that parks, police and MNPD are offering support to our team because yes, service providers wear capes, but not those kind of capes.
Thank you, Director Calvin. Let me get Councilmember Welsh.
Thank you, Chair, for recognizing me, even though I'm not on the committee. I have a couple of follow-ups to some questions that my colleague, Mr. Huffman, asked, and then I have a few other questions. Those 54 people you said were housed, are they housed permanently or are they still at the roadway?
I like that question because, see, our main goal here is we will provide interim housing options that lead to permanent housing solutions. And so it's just been less than 30 days that they've been moved into roadway. And we have to be mindful that several of them have been out there 20 years, 10 years, 5 years. And some of them are having a very difficult time with getting documents, the birth certificates that would be needed for permanent housing options because they may not remember their mother's maiden name. We have a lot of barriers there, but we're working through those barriers by having intensive outreach efforts, which is following this goal of the strategy as well.
So they're in the transitional housing, and so we're not really following housing first because they're transitional. And what about in terms of what CM Huffman was talking about, when they fence off the area around Old Tent City, where will those people go who are still left?
So to go back to your first statement, Dr. Sam Simbaris has really vetted our process. We're working closely with him. He is the originator of Housing First, and he fully understands the process that we have. I think that as we're bringing on the unfortunate piece is bringing in people, large encampments, 125 people. There's no really readily available housing opportunities. So, especially if they don't have a birth certificate. So I don't recommend, and he definitely does not recommend leaving people outside while waiting to get those documents.
So what is the plan for the Old Tent City residents to get them into permanent housing, since I know Section 8 vouchers, they're offline. I know the senior care level ones are back up, but there's a big waiting list for that. And now that Strobel House is full. So what is what's the plan for getting them into permanent housing?
Great question. We're being very creative. There's several people that have actually have income. So we're looking to do shared housing options. I don't know if anyone knows, the best kept secret here in Nashville is shared housing is $300 a month. Shared housing is $300 a month for people that have a disability or disabling conditions. Another plan would be recovery. We have a lot of partners in recovery, just left the opioid abatement continuum of care, and there's partners that have recovery funds, and then several other options, but you probably noticed in the mayor's announcements, there's some funding that's being set aside for what we consider non-traditional rapid rehousing, because the rapid rehousing components that come by way of the COC, they would need all of those documents and birth certificates in order to qualify for a lease. Things to celebrate is we, on an average, throughout our low barrier housing collective, we have an average of 700 vacant units of landlords, property owners that are willing to partner with us as a community. And the unfortunate piece is we don't have the subsidies attached at this point. So if you all approve the mayor's proposed budget, there's some non-traditional rapid rehousing dollars there and some operating costs for permanent supportive housing that could help with that as well. So a plethora from future funding, from current COC funding, from shared housing options and recovery housing options. And there are some spots for Family reunification, that's a huge component of housing. Individuals that may not have the cognitive development to be able to afford or maintain a home on their own.
But so is there actually a plan for that?
I just gave you that. That's the plan. All of that, and it's written out here. So that's the plan.
So are residents able to stay at the roadway longer than the 120 days? If they can't
Absolutely.
find housing?
And I think you may remember from prior operators of the hotel conversion property there that that happened quite a bit. And so we're working with the new vendors. We actually will have staff that's there to help with giving rides to get birth certificates and the vital documents that are needed.
And how long can they stay there transitionally?
The main goal is not to give a number of how long they can stay there, because what we would want them to do is to find housing as fast as possible. If we give a number, sometimes that gives people like, hey, I don't have to do anything until a year because I can stay here for a year. So I would never say that publicly either.
How long does the contract with Hospitality Hub last, and what is it costing?
The contract with Hospitality Hub is 18 months, and I believe it's $2.4 million.
And when is it up for renewal?
I don't have that information in front of me. I wasn't expected to answer these questions today, so I can get that to you.
Are there other housing options being offered to people who don't think the roadway is a good fit for them?
Yes, so we partner with CCF. That's another church conversion that receives some ARPA funds. And the most important piece that I want to hammer home, the vouchers, 18 vouchers a month, was never going to get us out of this housing crisis. And shared housing, we're part of a national organization that is really doing a lot of training on shared housing across the nation. And so our team has signed on to be a part of that initiative as well, because I think that's where we're going to get the best bang for our buck, having people in shared housing, keeping people in community, and having a much lower cost.
I'm sorry to interrupt because I just want to keep an eye on the time. Maybe we can do 2 more questions if you've got 2, and then I can see if anybody else has questions, and then we'll probably have to kind of keep going to see if there's any other department updates before we transition to our speaker, if that's okay.
Thank you, Chair. I know there are a lot of people in Old Town City who had barriers to housing. So what is the plan after we shut down on June 2nd for people who like have RVs or have pets or other things that can't be taken at the roadway? What is the plan for all those people who still have barriers?
Well, there's not anything that can't be taken to the roadway except for guns, arsenal, things like that, or the large RVs. But we have already moved 10 pets with the 52 to 54 individuals that's moved in. We've already moved 10 pets. Our team jokes about every time the van's pulling out, multiple pets are hopping in the car. So pets are allowed. I don't foresee that that being an issue. The RVs, and I think what I like to always say is like I'm really hoping that as a community, we all are agreeing that people living outdoors is not ideal, and it's not something that we should ever really advocate for, keeping people outside. Some of those RVs are infested with rats that are probably as tall as I am because I'm pretty short. They are infested with rats. The rats have chewed through the wires and the cables. We have RVs there that are full of animal feces to where the individuals in my outreach team cannot walk through the RVs because it's full of animal feces. That's not a good place for anyone to live.
Well, I don't think anyone here is ever arguing that an encampment or RV is a safe place for people to live. But again, what is the plan for dealing with that when June 2nd rolls around?
So we're working with MNPD on RVs. We've checked out some of the KOAs on if we could help get the RVs towed there. We've gotten VIN numbers. Thank you for giving me opportunity to be able to share all of the work that's going on there. We've got VIN numbers on the RVs. Some of the RVs, the VIN numbers have been filed off of. We're checking out like which ones are able to drive, what would they need in order to be able to be driven out of there, which KOAs will accept them based on the age of the RVs. We got a lot of work that's going on there. So, and it's across multiple departments. It's not we really focus a lot on the people and the pets. And as far as the automobiles or RVs, we have to turn those VIN numbers over to make sure that the owners are identified. A lot of times the people that are residing in them and the encampments are not the ones that actually own them as well.
So we're still in the gathering phase. We don't actually have the actual plan of what we're doing. We're still gathering information.
Well, we have a lot of information, so not necessarily gathering, but I think there's a total of 6 RVs, total of 10 vehicles total. And so to me, 125 people, I think it was most appropriate for us to go ahead and move forward with, knowing that those vehicles or RVs were not in any condition. Because if it was a building, this is what I have to explain to myself, if it was a building, codes would be in and it would be condemned. So there's a lot that goes into RV that has rats this long or feces, because we would not allow someone to live in a home like that either.
Yeah, thank you. Thank you for the
Chair.
questions, and thank you, Director Calvin. And anybody else have anything for Director Calvin? Okay. I appreciate you guys taking some questions on the fly. Anybody else department-wise have any updates before? I don't see anybody raising their hand, so let's get our speaker to come down because I'm really eager to have her speak to us about Thistle Farms. Amanda Clellan. Come on down. Everybody in here is familiar with at least products from Thistle Farms because Councilmember Gadd was gracious enough to gift us with some Thistle Farms product in our first year, and I still use mine. So with that, I'm going to open the mic for Amanda, and we will get started. Let's see.
All right. Thank you, everyone. Thank you, Madam Chair, and thank you, everyone, for your time. My name is Amanda Cleland. I am the Director of Communications and Advocacy at Thistle Farms. If you are not aware of what Thistle Farms does, we are a nonprofit justice enterprise located in West Nashville. We provide services to women survivors of various types of commercial sexual exploitation, mainly human trafficking and prostitution. We do this through a 2-year residential program, meaningful employment, and a lifelong community of support. So to give you an idea of what we do, we've sorted our services into 4 different service pillars: house, heal, employ, and respond. You'll see that the way that our services fit into those service pillars closely aligns with the priorities of this committee and so many of the metro agencies that we work alongside to help provide safety, health, and support resources for Nashvillians in need. A little bit of a breakdown of how we are funded. We are primarily funded through individual, corporate, and foundation donations. So a lot of our revenue comes from individual donors specifically, and then our overall revenue resources are kind of split evenly between those individual donations or large-scale donations and our sales from our social enterprise. Our house and heal pillars really are centered around the residential program, which is the heart of what we do at Thistle Farms. I'll go into a little bit more of each of these individual programs, but just keep in mind that without that residential program, Thistle Farms would not be here, and none of the 190 women who have graduated our organization's residential program since 1999 would have had the support that they need. We do operate a safe house, which provides 30 days of crisis stabilization services for women in need coming off of the streets. This includes addressing immediate health care needs, assessing whether or not they are in need of any mental health or substance abuse disorder support services, case management, which includes getting access to those vital records that folks need, such as their photo IDs, which are often taken from them by traffickers and pimps. And referrals to sources and resources for direct services that can best fit their needs, whether or not that is here in Nashville through Thistle Farms or one of our many sister organizations across the United States. In 2025, also, our Safe House, because of the demand that we have seen regarding law enforcement, we work very closely with MNPD and the TBI on human trafficking stings. We had to increase our Safe House bedding plan from 4 beds to 8 beds to better meet those needs. And that is something that we are working on and trying to grow support for, because we don't foresee that slowing down anytime soon, unfortunately. Our 2-year residential program, really provides a long-term care solution for women who, quite frankly, have not had access to the same opportunities that so many of us enjoy and take for granted. For so many women who come in, due to substance abuse disorders, for a lot of halfway houses that they go to, that's only going to be about 30 days, maybe 90 days tops. That does not allow you the time to do the work, decompress, and reestablish a solid foundation to rebuild your life. So our program is 2 years where we provide housing, food, basic necessities, including a stipend for clothing, trauma therapy, healthcare, weekly psychoeducational support groups, such as financial empowerment, DBT, art therapy, and so much more, and case management, where women are the co-pilots in their own recovery plan. We do have to include certain things from a clinical perspective to ensure that those needs are met, but otherwise they get to decide what their care plan looks like for those 2 years to best meet their needs and their goals for when they graduate the program. And all of that is provided for free, because when you have someone come into a residential program and you're asking them to pay for the services that they're getting, knowing that they may not have had a stable job history, may not have graduated high school, might have a number of obstacles standing in their way, it's just not fair to ask them to pay for that. And so this is really a way to have a reprieve and to be able to reset. A couple of our additional programs that we do, we have a partnership with the Tennessee Department of Correction through the Tennessee Prison for Women, the Deborah K. Johnson Rehabilitation Center, called Thistle on the Inside, which essentially allows currently incarcerated women who are in prison due to trafficking charges to begin their healing journey by taking some of those psychoeducational classes that we provide while they are still incarcerated, and then they are able to parole directly into our residential program. That helps to greatly reduce those rates of recidivism that are already disproportionately high among women and disproportionately high among women survivors of human trafficking, because they know that the Department of Corrections, the Board of Parole knows that women are paroling into a safe program where they will have immediate access to housing and employment. We also partner with a number of organizations such as the Metro Office of Homeless Services, as well as another number of community organizations in our street outreach program, where we go to high traffic areas, high risk areas like Murfreesboro Pike, Dickerson Pike, Gallatin Pike, that are known for high prostitution and trafficking activities, to be able to distribute hygiene bags, condoms, food. We've participated in needle exchanges, everything so that women can be healthy and have the time that they need and the resources and the information to then reach out to us when they are in a position to get out of the life. And then we are able to help them either through our Safe House, our residential program, or more. And we also have a national network because our community is not the only one that is affected by this issue. And so we have partners, 81 sister organizations across 33 states in the United States, where we provide education, resources, best practices through education workshops, conferences, and partnerships to be able to help others create similar programs in their communities that best meets their needs. Once you get through the housing and healing process and during the housing and healing process, then you also have the component of meaningful employment, because you cannot sustain housing or healing without meaningful employment, without the ability to provide for yourself, to sustain housing, to sustain your health. And so after the first 90 days in the program, we have a job readiness program, which allows women the opportunity to kind of do a reset of those skills that so many of us take for granted, because we have built those up over the years through our job experience and our education, whereas there are a number of women who have survived prostitution and human trafficking that were either not able to graduate high school, not able to have a stable job history where they would learn these soft skills. That includes conflict management in the workplace, digital literacy, sending an email, understanding a number of those things that, like I said, we all take for granted. We also have 2 other phases of job readiness that kind of progress along, where we can do career mapping and different types of assessments of what your interests are. And then we have an internship program at the end so that women can explore different opportunities beyond our social enterprises to learn whether or not they want to get into fundraising or communications or sales in some other capacity. And it's been a really great way to we've seen within our social enterprises, within our body and home manufacturing and more, that this program has helped to cut down on the workplace conflict that can naturally arise in any workplace, let alone when you are in a community where you are healing and processing trauma alongside others that you also live with, which can be very difficult sometimes. Our body and home social enterprise began in 2001 because we saw that a lot of women, as they were graduating from the Thistle Farms program, completing that program, they were boomeranging right back into our community for support because they were not able to sustain housing or obtain employment. That can be due to a number of reasons, including their histories of incarceration, homelessness, addiction, and more. And so, I have on here that exercising understanding regarding background checks, criminal records, trauma, mental health needs don't necessarily align with the priorities of most employers when they are just looking for how can they advance their bottom line. And so we really aim to provide a setting where we can take those things into account, leave room for people to be people, and all the messy ways that can occur, and help the community grow from that. Like I said, that body and home effort, it provides stable job history, manufacturing experience, shipping logistics experience and training, forklift certifications that we do alongside Goodwill, and so much more to provide more opportunities for the women who go through our program. We also then started our cafe over on Charlotte Avenue, which I think some of you are very familiar with. It is a way for us to expand our social enterprise into the hospitality and service industry that is so big in Nashville, but do so in a recovery-friendly environment, which isn't always the case in the hospitality industry. We also provide a lot of second chance employment through our cafe, in partnership with Dismiss House, where we have a number of men who go through their program, who work with our cafe, not only to have a second chance at employment, but also to model what healthy relationships can look like with men for a community of women that have been done wrong by men a lot in the past. And it's been a wonderful partnership that we really love and look forward to continuing. Our final service pillar is Respond, where we do advocacy and outreach. And so with our advocacy work, it is mostly going to the women of the program and saying, hey, what is standing in your way? and how can we work alongside government partners, agencies, and look at policies to address those things that are standing in your way so that we can clear the path for you. The majority of our work has been done on the state level in terms of legislative and policy work. 2002, we worked with the state to pass a record expungement, more record expungement opportunities for nonviolent offenses that are on the criminal records of women survivors. 2024, we were able to amend Tennessee's longstanding aggravated prostitution law, which had required women who were arrested for prostitution and also found to be HIV positive to go on the sex offender registry for the rest of their lives as violent sex offenders, which then completely cuts out opportunities for housing, employment, just being able to exist in the world in general. And so we were able to amend that while working alongside law enforcement to take that SOR requirement out, which allowed 86 individuals who were currently on the SOR to roll off of it, as long as they had no other qualifying factors that they needed to be on there. And then this year, we also passed the Ink of Hope Act, which will tie human trafficking awareness training to the licensure process for tattoo artists to try to provide yet another point of potential intervention, so that if a tattoo artist is placing a tattoo and they see that the individual in their chair does not look like they want to be there, want to be getting that tattoo, but it seems like there could be some factors indicating that they're being pressured to, or that they've been brought in by someone that they've seen multiple times bringing in different women to get a similar tattoo. That can be a point where the tattoo artist can then gather information and report it to the authorities in the correct way that protects the tattoo artist, but then also gives authorities, law enforcement, the ability to intervene safely. We have a number of partnerships, like I said, with Dismas House. We work with MNPD, the TBI. We have worked with Mental Health Cooperative on some de-escalation trainings to help those who come into our public spaces, like our cafe and shop, who may be experiencing a crisis, because we are seen as a safe place for a lot of individuals who have been going through a crisis. How do we respond to them correctly so that we are helping, not hurting? We can also apply those practices within our own program. We work closely with the Metro Office of Family Safety on all interpersonal violence task force efforts. And we are working with the Nashville Police and Public Safety Alliance on an upcoming partnership to be able to facilitate conversations and bridge building between law enforcement officials at MNPD and survivors of human trafficking to be able to share experiences so that everyone can learn from one another. We also have a partnership with the Tennessee Secretary of State's office on the Tennessee Businesses Against Human Trafficking program, which provides training, human trafficking awareness training to businesses across the state of Tennessee, from large corporations to small mom and pop businesses. And then finally, a lot of what we do is based in education, which is engaging storytelling, and storytelling in a very thoughtful and respectful, trauma-informed way, so that law enforcement officials, legal professionals, healthcare providers, anyone who works in an industry that can interact with human trafficking victims when they are at their most vulnerable can have a little bit of firsthand perspective on what those interactions can do in both positive and negative ways to hopefully inspire more compassionate interactions in the future. And then I have on here just some helpful context and information for anyone who is looking to work from a policy perspective, collaborate with us, as well as if you know anyone, constituents who may need help, how to reach out to us so that we can try to get you connected with the right resources or with our program. So I am happy, I don't know how much time I took up, but I'm happy to yield to any questions. And please know that I'm not the subject matter expert, but if I don't know the answer, I will write it down and I will get you the answers.
Thank you, Amanda. That was really helpful information. That presentation, the council office has it, so we can distribute it amongst the committee members. That's a question for you. Can we share that? Okay, great. Okay, I appreciate that. And then one of the questions I had, I wrote down, when you were going over the counseling services, the DBT, what does that stand for? Is that a specific kind of therapy?
It is, and off the top of my head, I am blanking on what that
Okay,
is.
that's fine, that's
I'm
fine.
sorry.
And then the other question I had is when you were talking about kind of like the transition through the different job training opportunities, and then you get into the social enterprise side and the cafe and the home team and everything. Like, is that, if you are going through the program and you get through and then you can get a job doing one of those things, is there any limitation to like how long you stay doing that work, or really it's just your motivation and if you want to keep kind of excelling within the organization?
There really is no limit other than the fact that if, like any industry, if the margins aren't there for us to be able to create more jobs, then that can stand in the way. And that is why additional partnerships with outside organizations that are committed to providing a trauma-informed workplace or working toward providing a trauma-informed workplace are so important, because we only have so many jobs that we can provide. And I mean, just this weekend, we had 11 more women complete and graduate from the Thistle Farms program, which means many of them were already working at Thistle Farms, but we also have a number of women who are going to be coming up and graduating next year as well. And so it's all about those partnerships to be able to provide more opportunities.
Okay, that makes perfect sense. Let me get Councilmember Prep T, who's got a question.
Thank you, Madam Chair, and thank you, Amanda, for this presentation, and particularly for your work up at the state legislature. I know getting that bill done through in 24 was an endeavor, so definitely worth congratulating. So on that same vein, I wanted to ask about folks who come through the program who have had previously registerable offenses on their record, and knowing that both AP and CE are no longer registerable offenses. Do you all provide legal services for getting those folks removed from the registry, or is that an independent service that they need to seek out elsewhere?
We partner with a number of organizations like the Vanderbilt Law Clinic, Belmont Law Clinics, a number of law clinics where they run expungement clinics for us to be able to help facilitate that. And if it is an expungible offense, we will work no matter how many efforts it takes, no matter how many tries it takes to get it off of somebody's record, because there are some women that, it's not just getting rid of those charges on their record, but getting rid of the court fees. If you don't pay a court fee and your license is taken from you, you can't get to work, and it starts a vicious cycle of not being able to sustain the life that you have worked so hard to rebuild. And so we do everything that we can that is part of the residential program, is being able to work on expungement clinics to get rid of as many of those offenses as we can. And if we can't, and that stands in their way of being able to work elsewhere, they will always have a place to land at Thistle Farms.
And then, so on that vein too, this might be more of a question for the folks who are running those expungement clinics. But within those clinics, are they also going through the process of trying to reestablish their voting rights, of either whether or not it's applying to the governor's office or the other, well, a lot messier now to try and get re-enfranchised, but are those services that are also being provided to folks?
I think that is built in where it's possible, but those are aspirations that I have for legislation in the future to be able to make that an even clearer path.
If you need any help on that, I'm more than happy to.
100%.
Thank you.
Thank you, Councilmember Prep T. How about any other questions from the committee? Councilmember Greg.
I don't have a question. I just want to encourage all my colleagues and Nashvillians, if you have not checked out the restaurant or the store, please go. And the best part is the beautiful women and watching the transformation. What I love about Thistle Farms, many organizations and nonprofits attempt to do this work. I think y'all are one that actually excels in this work, and I'm not discrediting the others, but you've somehow figured out the secret sauce. And I just want to praise that work and encourage everybody to go check it out. And DBT is dialectical behavior therapy,
Okay.
focused on behavior.
Thank you.
Thank you very much.
Thank you for your comments.
How about other questions for Amanda? I don't have any other questions, but I will also encourage it, of course, going, and I hope everybody in here has been, because it's amazing, and meeting with Amanda and getting even deeper into hearing about the programming and everything that they offer is so important. And I think it kind of really piggybacks on some of the questions we were having about Tent City. And the, housing is one aspect of it, but also kind of like the purpose side, and like, how are we getting people to kind of find like their path in life? And that's definitely something that you all excel at doing. And sometimes I think, on the housing side, it can be challenging for government to kind of be that facilitator. And so you all fill, a very important mission in Nashville. So thank you for all your hard work on that. Since there's no other questions, I will say, I know Amanda's got reports to be able to provide. And so Vice Chair Huffman, if you're able to be the distributor of those, I would greatly appreciate it. And then I will say that we have tomorrow, of course, our special called Public Health and Safety Committee meeting at 4 o'clock. It'll be here in the chamber, and we'll be talking about the immigration enforcement efforts or activities, illegal activities, all kinds of things that were going on over the weekend. So we'll talk about all that tomorrow at 4. Also, at our next meeting, I just wanted to highlight, and I'll be getting I've got some little flyers that I'll be getting put on everybody's desk, but this is from Metro General Hospital. And so there's a smaller version that I'm going to ask the council office to distribute. But Metro General's head of nursing, and then also the foundation will be here to talk about some of the work that they do, in particular around the All-Weather Wellness Fund, because, that has been a concern of mine for a little bit, related to, when we are releasing people when it's cold or when it's hot or whatever. A lot of times our unsheltered residents don't have, the clothing to be able to leave the hospital, but the nurses at Metro General are doing a lot of things. They're going above and beyond, much like teachers in Davidson County go above and beyond in terms of making sure that people are not walking out of that hospital, like wearing paper scrubs and things of that nature. And so they're doing their summer drive, and so essentially they're looking for new items. They told me that the biggest concerns that they have, or biggest needs that they have, are shoes in large sizes, and then also pants are also a need. And they're looking for new items because, of course, it's a hospital environment, and they want to make sure that people are leaving, with something that's hygienic. So you're going to have a small version of this little poster that they gave me that will come out on your desk. And if you have anything that you would like to donate to them, bringing it to the next meeting is a great time, because they'll be here to speak to us. And then also wanted to mention that we'll be having, there's a gentleman named Adam Rosenberg, who is actually a developer, and he did a hotel conversion in my district back in 2020. But he went down a path of, he kind of transitioned from being a boutique hotel developer to doing low barrier housing. And so he and I have had some interesting conversations, because he's learned a lot. He's worked with April and the team. He's worked with Open Table, a variety of providers in Nashville, and he's doing some really interesting projects. But I think he's got an interesting perspective about on the construction side and the building side of something that, work that he's doing, and where he sees like some of the challenges that residents are facing whenever they're transitioning immediately into kind of a low barrier housing situation that is not government operated, and not government kind of where we have that responsibility. So I'm scheduling him to come and speak to us as well. Anybody have anything they need to share, with the committee before we wrap up? Okay, with that, we're adjourned.